I would love if you could take a moment to introduce yourself and a little bit about your background and just to kind of kick things off.
For sure. Well, okay, so my name's Heather Toews, and I'm a registered clinical counselor based in Abbotsford, BC, but of course, see clients virtually in all parts of the province. Um, I guess you could, I'm like, how many careers should I count here? You know how that goes, right? But probably, yeah, I guess I'm in my second like career. My first career was actually working as a social worker. So I worked started off in child protection and eventually moved into working in the field of adoption, which was a real passion area of mine for 10 plus years. And it was actually when I got introduced to Dr. Bruce Perry, who's a developmental psychologist. Went to one of his workshops, a 2-day workshop, and was introduced to this neurosequential model of therapies and kind of went, oh, I want to do that. And I guess he had announced at the front of the stage that, oh, and you all could be doing this. And I had a moment where I was like, oh, really? Like I could take that training and I could be doing this work. And it was at that moment somebody corrected him and said, well, you actually have to have your master's. And I'd say probably 80% of the people in the room did not have their master's at that moment. And so my boss actually is the one that turned to me and I said, well, I guess I won't be doing that. And he's like, well, just go do your master's then. And I was like, what? Like it hadn't even crossed my mind. So at that time, my daughter she was about 11 and she's 23 now. And so I decided to go back to school. And so I got my master's and have been working in the field of mental health with children and youth and then also in private practice.
Wow. What a journey you've had, right? It sounds like you said, your second career and you were already working in the field of social work and adoption. And then you were really inspired by this modality and this
Yeah.
sphere of work. And it really encouraged you to pursue your master's and then pursue private practice and like these certain disciplines. If it's okay with you, I would love to learn more about like adoption and what adoption looks like in BC, as it hasn't been really a
Oh,
topic that's
yeah.
come up on this podcast really before.
For sure. Well, adoption, there's different routes to adoption in BC. You can adopt privately. That actually takes up the smallest percentage of adoptions. I believe my stats are going to be way off because I haven't been working directly, as a social worker in that area for a little while. But back in the day, maybe like 5, 6 years ago, they were only doing like 30 direct birth parent placements for adoption in BC, and that's attributed to all sorts of factors. People being being more acceptable to be, single parenting, more support out there, and then obviously people making choices to not proceed with pregnancies and things like that. So that number is much lower. Then we have, of course, international adoptions, and those occur around the world. However, there's lots of red tape around those and a great deal of expense. And then there's foster care adoption, and that would be where you adopt through the Ministry of Children and Family Development. And that would be that those adoptions are actually essentially free. There's a few costs like getting your medical done or getting your criminal record checks done, things like that. And with that, there also comes some opportunity for financial support with adopting children from foster care. So that's kind of that adoption process takes a while because you have to go through a home study. You have to kind of be initially screened in, go through a home study, and then it would be the matching process, which depending on your openness to working with any special needs or different factors that put your child at higher risk, then that can prolong kind of that matching process.
Hmm. And so just to confirm, so like a direct parent adoption would be, what would that look like?
So that would be, say a woman decides she wants to place her child for adoption. She would go to an agency. So I believe, like we have three, I think, adoption agencies in BC now. There is actually one based out of Kelowna, and then one on the island. And I'm unsure of the third one right now. Those are the two that I'm most aware of. And those adoption agencies then they actually provide. So an adoptive parent would go to those agencies, get a home study done, go through all the screening directly through them. They have, depending on which agency you go with, sometimes that home study can actually be utilized with the ministry as well. So you can put yourself kind of in both pools. However, you still have to do some screening through the ministry too. And then birth parents would actually go to the agency and they would actually be able to look through that adoptive parents book that they create. And I've seen some beautiful books done by some of my adoptive parents. Where they tell their story, they basically share kind of why they've come to that decision, what they have to offer, what their hopes are for openness, which is a really big part of adoption these days, as opposed to historically where adoptions were primarily closed. So there's, might be exchange of pictures or letters or even visits over time.
Okay, interesting. And so do you find that usually adoptions, like you said, only about 30 are in that way, which is such a small amount for like the entire province? And yes, this is maybe an older statistic, but what about like just like family members adopting a child?
That would be separate because that's actually a family member adopting a child would actually be done through a lawyer. So it's a little bit different than going through a social worker and so on. Um, I don't work directly with those parents other than post adoption support. So I'm not entirely familiar with that process, but I know it's more of a streamlined process, especially if that parent is like consenting to that adoption and their direct relative.
So you say you support parents more after adoption, not necessarily the considerations that maybe parents would want to have prior to adoption?
Well, I do both actually. So for example, right now I'm working with an adoptive parent who was going through and she's doing a different kind of adoption where it's a children that she actually knows, and so she is doing it's not a direct because it's just a child specific is what they refer to it as. So say for example, you have a relationship. Say you're friends with the foster parent, or say you are a family friend to a child that is going to be placed for adoption. You could theoretically put yourself in the pool. And if you have a home study, sometimes they're not going to wait for you to be ready. If the child is ready, then that child needs a home now. But say you were already considering adoption and all of a sudden that child becomes available, which happens from time to time, then because you have a pre-existing relationship with that child, you could be considered. They're still going to look at all of the factors, all of the things that would make you a suitable parent for that child, because we don't just place a child with an expectation that, oh, you can meet their needs now. We have to look at, can you meet their needs long term, and that might be based on their various risk factors or genetic loading for different concerns or things down the road.
Right. Okay. So that's really interesting because this is like a very unknown field for myself. It's not something that I necessarily work with. Would you say there's a lot of children that are in foster care in the province of BC?
Yeah, I don't know what the stats are right now. Now, not all of those children are available for adoption. So the ministry has taken a really big shift in trying to place children with family members or trying to find kind of those child specific placements. So connections already with family members. So, or with people that are close to that child, or making arrangements with kith and kin. So that would be maybe more about a legal transfer of custody versus doing adoptions. So it's more to kind of keep children out of the system versus, so that might actually happen much sooner before that child, it's even deemed that that child might need an extended or long-term kind of placement.
Okay.
So the world is shifting.
Mhm.
And a lot of that, even just within Indigenous communities, keeping children within their communities and such as well, it's very important.
Right. Okay. And so my understanding is like what you're saying is a lot more encouragement or trying to keep the families in their original household as long as possible.
Yes, or within their communities or with people that they're connected to. So sometimes kids, based on, depending on the circumstances, can't always stay at home, but they could stay with an auntie, or they could stay with a neighbor, or they could stay with a relative, like, just somebody that they already have a connection to.
Mm. Right.
Yeah.
And so, from a mental health perspective, like, why would that be so important?
Well, those attachments, right? And that familiarity, that the context of the community, if you think how much you kind of gained from your community, it's not just your parents, right? It's the norms within the area you grew up in. So, for example, moving a child uh, from a remote community to a city, that would be a pretty big adjustment for that child. Where if you could keep that child living in a similar kind of environment, depending on whether that's safe. I mean, I've had circumstances where there was an adoption placement of a child where the parents had come to BC but were from a remote community in Quebec. And when the worker finally was able to approach the community to see, was there any way of repatriating that child to their community? Was there somebody there that could care for the child? The response was, "This isn't a healthy place for this child right now." And so that child wasn't returned to their community, which was it was very sad. And then we had to find, a home that would, support that child's, cultural needs as well. So it gets complex. And I think there's a lot more guidance around, keeping kids within their cultural community. There's a lot more red tape, so to speak, to adopt a child that is not of the same culture, which is a good thing because it's making us really, consider all of the things that create that sense of even that sense of identity, that sense of self as that child grows up, which is a lot of the work that I end up doing with adult adoptees down the road. Just to answer your question about kind of the work that, at what stage do I enter? So I can enter in early as they're preparing, as the adoptive parent is preparing, whether they're working through issues that would impede their approval of a home study, or whether just preparing them. They do go through an adoption education program. So oftentimes they're front loaded with a lot of information. But what happens is when they're actually in their lived experience of parenting those children that have experienced some trauma, then that's when they need a bit more support. So sometimes I can do that, individually, like with those families, or I have created a course, which I created in grad school. We had to do a group design, and I was like, I want to do something that's really meaningful and useful to the work that I'm doing right now. And we just saw this gap in service of supporting families once children had actually been placed in their homes. So that whether that's 6 months or 2 years or 5 years down the road, and they're all of a sudden coming across, behavioral challenges or regulation issues and things like that, then we wanted to equip them. So that's where the trauma tuned parent course comes in.
Okay. Yeah. So, I'd love to hear about like what type of challenges are coming up that you really notice post adoption.
Yeah, well, it varies so considerably, right? And considering, the genetic loading, we could have concerns around mental health already preloaded, and we always talk about mental health as being like a predisposition and then a trigger, right? And so sometimes that can just be a developmental trigger, new stage of life. Sometimes that can be, something that happens in their life, and other times it is, where prolonged trauma that they've experienced is already starting to expose kind of those cracks. And so in early childhood, we may get a lot of diagnoses. And as you know, some of those diagnoses are often mixed up with trauma. And so you end up with, the oppositional defiance disorder, ADHD. Um, there's new labels for things these days, but really ultimately what we're looking at is basically emotional dysregulation. that is really based on their physiology and how they are developmentally managing kind of the external and internal kind of stressors in their life. And so, supporting parents through behavioral challenges or through a lack of connection that they might have with their child. We know just from the work of Gordon Neufeld that there's a lot of conditions that are required in order to form like a really deep attachment. I love his analogy. He uses kind of this plant analogy or where the roots have to go deep enough in order for that attachment to be really secure. And oftentimes, when you have a child who's experienced trauma, they tend to have more surface attachments. And that's to things, to peers, to maybe they have a very, tenuous attachment because they don't know how to trust because their trust has been broken, maybe not intentionally. Maybe it was a parent that, passed away, or maybe it was a parent that struggled with addiction and so they didn't know consistently whether they were have their needs met, and so they learn to not trust that their needs are going to get met. And so oftentimes when I talk about behavior, I talk about your child is doing their very best to have their needs met in the ways that they know how. And so essentially, I think the whole idea around the trauma change parent course is really just to like shift the lens in which we see our child, because it's really easy because parenting is such a reciprocal kind of experience. It's really easy to feel like our children are manipulating us, or they're doing things on purpose, or they're just, a naughty child or whatever, when really what they're doing is their very best to manage everything that's happening within themselves. And so, how do we support them through that? How do we provide them that sense of security, that sense of self? Identity is a huge piece with kids that have been adopted in particular.
That's amazing. And I really appreciate this idea of how you're saying shift the lens from, I don't know what the right adjective would be, but more of a compassionate or understanding lens, and understanding that
Yeah.
there is a lot of effort from the way that the children are interacting, even though it may not surface level appear in that way. So would you say like the work of Gordon Neufeld really like inspired that way that the course is built?
Yes, absolutely. There's a few, there's Dr. Gordon Neufeld, there's Dr. Daniel Siegel, Dr. Bruce Perry. Those are Dr. Karen Purvis. She did a lot of work with children in foster care and adoption. Those are definitely some of my inspirations, and a lot of the ideas kind of come from that, as well as from other research that is out there. I'm an EFFT, which is emotion focused family therapy um, workshop facilitator. And so I teach emotion coaching. And that, even just when I was doing the research for this course, it was one of the primary approaches that a lot of the successful parenting programs out there incorporated, and it so resonates with me, and it's amazing. It's actually such a this whole idea of this validation skill and this emotion coaching has inspired me to actually bring it into my couples work as well, because I think it's a skill that is useful everywhere. And so, but particularly in parenting kids that aren't maybe as well connected to their own emotional states. They don't necessarily understand, what it is that they're feeling. Maybe when they're sad, it comes out like anger, or when they're angry, they start crying. They're kind of their emotional states get mixed up, and so they don't know how to identify and share and then express how to get their needs met, right? And so when we emotion coach, then we are basically supporting our kids to understand what's happening inside here, what they might need. And from there, it's kind of like teaching. I hate to use this analogy because I just told you I use this with adults, but it's teaching toddlers language, right? So we're giving kids, if you think about your toddler and how they would freak out and melt down and have these moments. And then all of a sudden, once they have language, then it's like they can actually tell you, they don't have to show you. And that's kind of what I think about when I think about emotion coaching. It's like we're giving kids emotional language so that they no longer have to show us through these behaviors that are really distressing to us or really almost like repellent, which is in some ways that serves the function of like, if I, as a child, have so much shame, I'm going to make sure that I drive you away so that I can be alone in my shame, because that's a really ugly thing to show people. And so that's another piece of kind of what we talk about in this course.
Right. And so a lot of the emotion focused work comes in this course. So who would be like the ideal client or recipient of this course? Just to kind of let anyone know out there who's listening, if they're looking for something in this way, like, is this the right fit for them? What would you say?
Well, it's funny because originally this course was built for adoptive parents. And it is essentially evolved over the years. So originally for foster parent or adoptive parents, and then we kind of opened it up to foster parents, and then we realized, you know what, this is really just for any parent whose child has experienced trauma. And I think it's done in a sensitive enough way that it, even if you were a part of the trauma. So maybe it's a parent who has experienced addiction and, their child suffered because they weren't able to meet their needs during that time, or maybe crazy things were happening around them. Or maybe you have a child who has witnessed domestic violence, or maybe you have a child that, lived somewhere else before they lived with you. Or maybe there was, another parent who was abusive, and now you're parenting this child, maybe even independently, but maybe they're still going back to that environment. Those are all reasonable um, participants of this course. So really, it's for I think I would say maybe like I would say, I mean, I don't want to say zero. I mean, I think we don't necessarily address infancy, but I would say like from 2 to 18 is kind of the age range that I would consider. However, we don't specifically address like developmental uh, differences. So people that have I would say we don't address it specifically. Like if a person has diagnosis of FASD or things like that. But I think that if you consider your child and how you know your child, and you can make the appropriate adaptations, then it would absolutely be appropriate.
Okay, this is so wonderful. And I'm just sitting here listening, and I can even think of some clients and parents that I've worked with that would really benefit from this course. And I can just see how inspired you are by it and the reason behind creating it. So that's just so wonderful. And just, I think, like you're saying, it really expanded over time, because in my mind, I think what may happen, and this, I don't know how true this is, but just the exhaustion of parenting. And sometimes it's just about feeding children, getting them to school, and just like the day to day, that sometimes a lot of that emotion focused work gets really missed, or that true understanding of a child. And we both align within our trauma work with an EMDR. And I bet you can agree that many of the earlier childhood experiences or the touchstone memories are that moment of lack of secure attachment with a caregiver or a primary caregiver. And so it's really wonderful that it's kind of going like a bit of a restart or a reintegration of, hey, this is how you could really support your child, your um, whoever you're taking care of at that time, and really how to understand and have the emotional literacy for emotions and how to regulate emotions and express them in a helpful way.
Totally. And, I mean, the one thing I always talk about it with relational trauma, the primary mode of healing is actually through relationship, right? And so when we talk to parents about like it's actually, you we want to work with, not your child, when they get a bit frustrated, because I think that a lot of parents just want to send their child to therapy and have us fix them. And that's just not, if I think about it, like you spend 24/7 with your child, or, outside of school or whatnot. But, and me spending an hour with your child a week, it's not going to have the same effect, right? From emotion focused family therapy, they talk about how I might get the story a little bit mixed up, but I'll give you the basics of it. This woman had had a car accident, and a therapist, they were doing this research. They had this therapist sit and hold this woman's hand while she was getting an MRI. and say all of the perfect things, right? Like, this is so hard for you, and, go on. They, as they were doing the MRI, there were like these sparks, like little sparks happening. You could tell like that she was responding to the comments and so on. Then they brought in this woman's partner, and they had this woman's partner sit there and hold her hand and say all of the imperfect things, but was present and just like trying their hardest, wasn't as like fluid and, well formulated as the therapist. And those brains were on that brain MRI was on fire, right? So we give this analogy because it's like, it's even though you may not do it as perfectly, and I'll teach, I'll walk through examples with the parents I work with, and walk through an emotion coach with them. And they'll be like, I wish you were just like in the room with me and you could tell me what to say and whatever. And I'm like, yeah, but me saying it in my words is not nearly going to be as impactful as you saying it in your imperfect words. You are the one that makes the difference. And so teaching parents to become the therapist, so we call it like basically therapeutic parenting, is way more effective than me doing that 1 hour a week.
Yeah, what an amazing story and example. And just for anyone listening, fMRI is when they're showing like the highlight and the activation in the brain and those sorts of things. And so it's so
Yes.
interesting that despite having that person that has such a strong attachment with you and saying not quite the right things, there's still so much more activation and connection happening. And it's almost interesting because it makes me think of this idea that um, someone that we have a strong attachment with will hurt us so much deeper than usually someone like a stranger, right? Because we have that attachment, it's so much more important. And it's really showing like the needs for parents to really kind of step up and be that therapeutic approach. Would you say that you also kind of align a little bit from the trauma approach of like Gabor Mate as well and his work?
Oh, absolutely. Sorry, I shouldn't. I have multiple books on my
Yeah.
shelf right in front of me here. Yes, absolutely. In fact, I've done his compassionate inquiry training. Oh, my goodness. If you ever want to go do like an amazing training and watch like 30 live, therapy sessions in front of you, go to his training. It's amazing. But yeah, definitely. Like, and even just like, I think the piece that we haven't really touched on is that each of us as parents come into the relationship as a parent with our own experiences. And I've actually done a course on the book that's based off of the book. It's not available out there anywhere, so don't go looking for it. But it's Parenting from the Inside Out. I'd highly recommend it as a book. And it's really looking at like how our own experiences impact us as a parent. So even just things as like our memory templates and how we are so easily triggered by things that our kids do. And again, that kind of goes back to, and I think both Dr. Gabor Mate and Dr. Daniel Siegel talk about that reciprocal parenting. If we are parenting a really difficult child, think about how incompetent you feel, right? And how can your child not pick up on my parent doesn't know how to handle me, which then is going to elicit a different response. It's going to elicit kind of an insecure response. And maybe they're not going to come to us with things, which is going to elicit a response from us. And then it's like, it's this tumbleweed effect, right? Like it's just going to get bigger and bigger and bigger. And so learning how to respond in ways that maybe are counterintuitive for us. And then also figuring out how can we regulate our own system going in. I think about like all of my bad parenting moments, almost all of them are about me, not about my kid. I can't reflect and go, oh my gosh, she was so naughty that day. She was so terrible. Like it's usually like, oh my gosh, I was so dysregulated. I had so much going on. I was not very patient. Like it's usually about me. And so that's a lot of the work that I'm often doing with parents as well.
It's really about like how, as a parent interacts with the child, not necessarily the child's behavior. It's like how that flow of relationship is. So I'd love to ask you a question that I've been asked by clients many times just to have your take on it. The question usually is like when I speak about trauma and how this idea of like the grandparents parent the parents and the parents parent the children. And if the grandparents were struggling, then sometimes that can affect the children, so the next
Yeah.
generation down. And like then when we talk about that, clients usually ask me that, well, if I parent now the great grandchildren, can I stop that cycle?
Yeah.
What would you
I think,
say?
I I would say you can shift that cycle.
Hmm.
Absolutely. I think you can stop the cycles of abuse and so on. We're always in a cycle. We're always like, even if you think about like what your parents did was probably better than what their parents did, right? Like we're always trying to do better. But say, in my experience of parenting, like, I mean, I don't think my mother was a terrible mother. She was doing the very best that she could, but there are certain things that I try to do differently from my mother. And sure enough, as I go through and I start to learn new things, I almost inevitably have this little wash of shame that comes over me. So particularly when I first started learning about trauma as I was training as a social worker, and I started to have these moments of like, oh my goodness, like, well, I do that. Like, have I messed up my kid or learning things about what things that happened to me, like, oh, how messed up am I? How am I going to be a good mother? And I think even when I learned learned the emotion coaching skill, I had this moment, and my daughter was 15 when I learned emotion coaching. And I remember thinking, like, I needed this when she was 5. Like, why is it that I'm only learning this now? So I think it's unrealistic to, yes, I believe we can stop the cycle. I think it's unrealistic to think that we aren't perpetuating just a new cycle, and it's okay, right? Because, we are always doing the best that we can. I think that there are particularly, cycles in families that are where there's abuse or where there's, maybe substance use or where there's, you know, any of the isms, the racism and so on. Like, we can stop those cycles. We can stop that generational trauma from continuing on. Um, but I think inevitably, we have to accept that we just have to do the best with the information that we know now. And so even when I teach the trauma chain parent course, it's always with that understanding of like there's going to be new things that you're going to learn. And some of these are going to fit for you and some of them won't. And you are probably already doing some really good things that are working for your child. Don't stop doing those things just because I'm teaching you something new, right?
Right. I really love that answer too, because it's really hopeful. Because a lot of parents or individuals that I meet, they go, well, is this going to be able to change for me? Like, am I going to be able to do enough? And I really resonated with that idea of that wash of shame. But it's like once you are like have the light bulb moment, perhaps, of like how to maybe do it better, despite already always trying to do one's best. So, from the therapy modalities that you use, could you give some examples of how you would maybe support a person in that situation of trying to reduce or stop that cycle of intergenerational trauma?
Yeah, for sure. I think that probably one of my primary modalities for treating trauma is EMDR,
Hmm.
and I'm actually trained with Laura Parnell's attachment based EMDR, which I always just describe to my to the individuals I work with is just like it's more relational, it's more intimate, it's more bringing in what you needed then now. And so oftentimes we are working with, yeah, those internalized beliefs we have about ourselves. And so, just for example, I'm working with a young woman and her belief about herself is, I don't deserve to take up space. And so if you think about how that individual goes out into the world, they're kind of like tentative. They, and even just thinking about, she's not a parent at this stage of her life, but when she becomes a parent, does she tend to overcompensate or does she tend to, maybe she becomes this gushing parent that is like trying to do the opposite of what her experience was and maybe not in a healthy way, right? And so in that case, what we are doing is we're taking that belief and we're kind of like I was talking about creating an umbrella over that experience or that belief of like I don't deserve to take up space. And that's where that three-prong approach of the first, worst, and the most recent.
Right.
But then we also integrate, the protector and the nurturer.
Right.
and the wise advisor. And oftentimes I also bring in their wiser adult self. So maybe that's the adult self that's like 20 years from now that's going to have all of the wisdom about the challenges that they've gone through and that knows. Or I have, kids that I work with where it's like, 5 years from now when this doesn't matter anymore, this is what I would tell myself now, things like that. So oftentimes I do like kind of I call it a skipping stone history.
Yeah.
And so we'll do a little bit of a developmental attachment history and kind of gather kind of the main themes of the traumas that they've experienced in their life. And I talk about big T and little T traumas. The big T's being, like, oh, my parents got divorced, or I was in a car accident, or the things that we can really put our finger on. But then also the little T traumas, that persistent invalidation of my feelings, or the persistent low level bullying that happened throughout my life, or not being encouraged, and the impact that those things have. And then we look at which ones really align with kind of what's getting in the way of them living their best life right now, or what's getting in the way of them parenting the way that they want to. Right? Maybe it's because they have this really big trigger because of something that happened to them when they were little. If there's a definitive, kind of thing that we can put our finger on, they'll work through, those things. But sometimes it's so pervasive. It's not even, something that we can put our finger on and say, oh, it was when that happened, then my world shifted or whatever. So
Definitely. Because it's like that, but when you say that belief of, I don't deserve to hold space, or it's very much not, when I explain to individuals, I always do a discussion of like what a belief is. And I try and conceptualize it for them in terms of percentage. You never 100% believe that, because there's some like, you're able to lean into the logical, intelligent part of your brain that kind of goes, well, this doesn't really make sense. But there is a strong percentage that emotionally believes that and has the evidence to support that. And so it becomes really a challenge to find those memories, like the evidence that supports that beliefs and that created that adaptive idea and belief to hold that. And then how that shows up in different current experiences or thoughts of the future, right?
Totally, totally. You're just, you make me, as you talk like that, you make me think about Dr. Gabor Mate's compassionate inquiry, and how he kind of can take that, say that experience, that feeling that you have right now, and say like, can you think about like how old you feel? And so the person says like, well, I feel like I'm 7 and I'm getting scolded by my mother or whatever, like, and then even just defining like, what did you have to do back then to survive that, And then he does this thing where, I kind of almost imagine like, oh my gosh, can you like give yourself a pat on the back? Like what a brave and intelligent 7-year-old you were, that you knew that you needed to adapt that behavior and whatever in order to survive that really difficult experience. Like, wow, like, can you just thank that part of yourself? Like, that was just so, so incredibly brave, right? I wonder if you can now tell that part of yourself, like, I'm safe now and I don't need to keep doing that. And it's kind of like, I mean, I'm really like shrinking down this. Yeah, though, or I have to say he does these like 10-minute long like therapy sessions that are just like blow your mind and shift people's perspectives and whatnot. But really that sense of like, what can we thank ourselves for in having survived difficult circumstances, and now be able to kind of put that in its rightful place and say like, have it become part of your story. I just worked with this young man who we've been doing some EMDR around an experience of bullying, and now his sibling is in the same boat, and he's never been able to fully share his story with his parents, because he would always break down crying. And this last time when it happened to his brother, he was able to go to his parents to say, hey, look, this is what really happened to me. This is how it impacted me. And he, as he's telling me this, he's saying, and I told her just like this, like it was just a part of my story. Whereas previously, like in the beginning, when he first shared this part of his story, it was like tears streaming down his face, like he couldn't share the whole story. And so that's what that reprocessing of that trauma kind kind of does. And I think about like how much of what we carry from our childhoods into our parenting is really, that internal, it points to that internal work that we need to address within ourselves. And I think that's where the real healing begins, for our children or our grandchildren, if you will, is when we do that work for ourselves.
Definitely. And just when you were speaking, it kind of inspired me this idea of like the Gabor Mate inspired protocol almost for EMDR. As you were describing it, I'm like, let's add some BLS right there because that sounds so healing of like
Oh, I do a
installing.
lot of.
Yeah. Like those sound like some really wonderful interweaves or resourcing, right? To kind of install that and along with like all of like Lauren Purnell's attachment figures. And so I'll just like kind of express what that is briefly here. It's like this idea that we can install an attachment figure. So it might be a person that we really know and can conceptualize, or an imaginary person that we create that we're longing for, that provide that sense of safety and security. And we can use the bilateral stimulation to install that figure to guide us and help us through our own individual processing, reprocessing, and desensitization. So it's really wonderful how you're kind of expressing this idea of like how as a parent we have to be at peace with our own challenges to be able to be most at peace within our parenting styles. But I do want to jokingly reassure any parent out there that you're always doing your best because I think that sometimes it
Absolutely.
can create some induced fear with this idea of, oh my goodness, I'm not quite meeting up to the standard or needs. But I think it's always just number one, having compassion. And number two, just constantly trying to be mindful and aware, just checking in, because I think autopilot happens a lot in their day-to-day life, right? It's the Monday to Friday. Next thing you know, it's Friday evening at 6 o'clock. And you're like, where did the week go? And,
Yeah.
we're getting busy weekend ahead still. And that's when everyone says time passes so quickly. So it's just taking those moments to check in.
Absolutely. Yeah. And that's a big part of this course too, is just kind of again trying to kind of gain that individual perspective and taking those moments, teaching our kids mindfulness even so that we're, maybe we're practicing it in front of them so they are also seeing it. And then I often will talk about, I know one gentleman I worked with, probably the biggest learning for him was that the space between a reaction and a response was 5 breaths,
Yeah.
right? Like to change from a reaction to a response was like taking 5 deep breaths. Sometimes it's only 3, and that's enough, just before he goes in and responds to his kids, because it is just oftentimes what's going on within us that comes out versus what's actually happening with our child in that moment.
Definitely. I think that's a really wonderful idea to kind of understand because a lot of the times within emotions, we think something happens, like a situation or a stressor or whatnot, and then we think something and then we feel something and then we do something, right? But a lot of times, if we're not really slowing it down enough, we feel as though something happens and then we do something, the reaction. But we really have to learn how to
Yeah.
slow that down and learn that gap between the reaction and like a response that is more in tune with what you really want to be putting out or in which ways you really want to be parenting your child.
Absolutely. And I mean, all of that also comes down to like, how are we caring for ourselves as parents? And, oftentimes, I even ask that question in my intake. It's like, what are your coping strategies?
Mhm.
And, some of them I'm like, all right, like they got it down. They got lots of things. The other ones, it's like sleep, eat, drink,
Oh,
and it's like, okay, so we need to expand
yeah.
that those coping skills. And so just even kind of, one of the things I often kind of implement with people that have dysregulation kind of even within themselves is just like, okay, so every 2 hours, can we do a regulating activity? Just something that
Yeah.
brings you. And it's that idea of like, can we teach your brain how to regulate that it, or can we remind your brain that it knows how to regulate? And
Yeah.
so just that, but just with that consistency, I think I had this awesome supervisor one time who used to have the mindfulness bell on her phone, and it would go off every hour. And I swear it didn't matter whether she was in a meeting or in supervision with you or with a client. When it went off, she stopped and she would say, I'm sorry, I just have to take a moment to do my mindfulness breathing. And then she would take a couple of deep breaths, and guaranteed you're going to do it with her because it was awkward to
Yeah.
not. And it was just like, I think it just resonated so much with me and she was probably the most zen, peaceful, person I've ever met in my life. And just how like each of us can kind of bring that in some small way into our lives. I refer to myself as a lazy meditator.
Mhm.
So I'm like, I always pick like the 1 to 5 minute meditations on my
Yes.
apps and stuff like that. And that's, what, I mean, some people, great, good for you if you can do 20 minutes
Mhm.
or half an hour. But you know what? Sometimes all we need is a minute to 5 minutes to just,
Yes.
because I think oftentimes parents get a little overwhelmed with, what, I have to go meditate and, whatever. And it's like, no, you take like sometimes they'll say, go into the bathroom and blast your favorite song. Like,
Mhm.
so you can't hear any of the distractions out there and just enjoy that song for like however long it is, 2.5, 3 minutes, right?
For sure. And I think you really highlight the importance of a client may say, I regulate through exercise, but that exercise of 30 minutes to an hour may not always be available. So we need some quicker or less energy inducing coping skills, such as meditation. And the second part being having the acceptance that it's okay to take that time and that we don't need to frown upon like having to regulate versus it's a blessing to be able to regulate.
Absolutely. Yeah. And especially, if we have the wherewithal to be like, okay, like I am not in a good space right now. I say, as long as your child is safe,
Mhm.
take that moment to regulate. If they're not safe, create safety, then regulate, then go back and actually respond to the situation.
Exactly. Yeah, I love that reaction
Yeah.
versus response for sure. That's so important. Um, so is there anything else that you wanted to share about your wonderful course that you created that we've missed that you feel like should really be highlighted?
Perhaps we can share the link for it.
Yeah, we can
It's
definitely do that.
six. Yeah, I think one of the things when I was creating it, I really wanted to make it approachable. So it's actually and digestible. So it's actually 6 modules, but they're all broken up into individual lessons. And after each lesson, there's a handout that has like all the primary material summarized, as well as has there's an integration little video that comes afterwards, which basically talks about like how you can actually integrate this into your week. So, or into your day, and gives you a little bit of a homework piece, maybe something to think about for yourself. It's very short, very bite size. I think I can't remember the longest module, or the longest lesson might be like 17 minutes, but on average, they're kind of about 10 minutes each. And so just really accessible. I've actually one population group that I didn't really talk about was like staffed resources. And that's another great resource for those staff members as well. And it's also a course where, yes, they build on each other, but it's also like, if you're like, I know I've done tons of courses on this area, you could skip ahead and go to pieces, or you can go like, oh, we don't have any sleep problems, so I don't need to do this one. Like, so in that way, it's well highlighted, what you would gain from watching this module. And so it makes it just that much easier for busy caregivers.
Yeah, that sounds so wonderful and such a helpful resource as
Yeah.
well. Yeah, so far we've kind of today talked about adoption, the process of adoption, what that kind of looks like within the province of BC, and some challenges that both the children and the adoptive parents or caregivers would have, and the wonderful deep dive into trauma and the course that you've created. So much wonderful things that we've discussed today. Was there anything else that we're missing or that you wanted to chat about for a few minutes, or anything else you needed to highlight?
Um, I
Pressure.
mean, I think maybe, yeah, no pressure. I was just thinking about like one of the population groups that we haven't it is a little bit unique, but still falls within the same
Mhm.
realm. Is I've been doing a lot more perinatal work recently.
Okay. Yeah.
In particular through COVID, I think a lot of clients that were coming to me were individuals that were like parenting newborns
Mhm.
or were pregnant, and then gave birth during the pandemic. And so a lot of isolation, a lot of post pregnancy anxiety and depression. And I think it just highlighted again a lot of the work that, EMDR is so powerful in. I've worked with a lot of birth trauma, pregnancy loss, working through, again, some of those beliefs that we have about ourselves as parents coming into a new role. It's just such a unique experience that, and I think given all the additional stressors that we have there out in the world, in particular, I have clients that have, developed a lot of fear, because of COVID and different things like health fear and things like that. That's been just another population group that I have just grown really passionate about, and really trying to do a lot of extra research around and so on, just to make sure that I'm really serving that population. And so, yeah, I don't know if that's really something to add, but just something that I think is such a, it's a more unique experience than I think we recognize, just that parenting in isolation during this time. And just even surrounding kind of, our support networks have become a lot smaller, because maybe we're limiting the number of contacts that we have when we have a newborn and so on. And the rules that people have around, visitors and things like that can cause a lot of friction in families. So supporting new parents with that as well has been a new part of my practice.
Yeah, that's so wonderful. And I can just see again, so passionate about that topic. And it's interesting that as the world changes and things happen in society, like a lot of times as clinicians, we shift or we become really inspired in a different direction, which is kind of, I would say a perk of our field is I knew when I was stepping into this field that it wouldn't always be the same. Like you can grow and change and step into new disciplines or challenges and different sorts of learnings and modalities. And so it's really wonderful that you've been able to connect and really serve and support that population as well, because I can imagine how isolating it would be to have one of the most joyous times of your life of expecting a child or having a newborn and not being able to really connect, in the same way. Like I always imagine like going to like parent and baby classes or celebrating the birth of your child with parties or really that social aspect, and it would sounds like very isolating to have that experience. And so I'm
Yeah,
thankful
well,
that,
thinking about what your mat leave was going to look
yeah,
like, right? And then all of a sudden, this is what it looks like. Yeah,
yeah,
it's been a huge, huge issue.
for sure. Well, Heather, I really, really, really appreciate you coming on today. I feel like I've learned so much, and I hope that everyone listening really learned a lot or had something really that resonated with them. You mentioned so many great resources. So I really appreciate your time today.
Well, thank you. Really appreciate it as well.
Yeah, wonderful.